Games in a virtual reality environment can relieve physiotherapists in their everyday work because they enable more independent exercises. The gaming aspect of the VR furthermore motivates patients to stick with their exercises. Using CUREO with a patient is very simple. The therapist has a tablet computer. The patient puts on a virtual reality headset and is immersed into a virtual world. We have several therapy modules. Stroke patients, for example, may have locomotory, cognitive, and sensory impairments. The therapist composes an individual program for every patient using the tablet, like a playlist in iTunes, for example. The therapy programs are adjusted to the patients both in difficulty and in therapy. The patients can then individually use their programs, but always in a group under a therapist's supervision. The system can even be controlled with the eyes, thanks to a connected eye tracking function. We can especially use tracking to bring patients very early into therapy, or patients who have very severe impairments. There is a camera in the VR headset that tracks the pupil. With the pupil's movement, patients are able to control elements in the VR environment. The CUREO therapy system is in use in 23 clinics so far. We know everyday life in clinics very well. This is why it was very important for us in the beginning to keep the technological effort for the clinics very, very low. We offer a turnkey system, which they basically only need to switch on. They have to plug in a Wi-Fi router, switch on a tablet and a headset, and then they are basically ready to start the therapy. The CUREO software is a certified medical product that has been available since February 2022. It especially helps patients in occupational therapy and physiotherapy, but also those with psychological indications and in care of orthopedic surgery. The system primarily is supposed to relieve the therapists and to automate repetitive tasks for the patient. At the same time, it simply and efficiently offers a variety of possibilities to motivate patients. They have more fun, are more motivated, and it is easier to nudge them towards therapy. The second advantage is that thanks to the individual group therapy, several patients can be supervised by one therapist at a time. When we visit a clinic and meet therapists who have not yet dealt with VR therapy, we are often met with skeptic reactions. In these cases, we ask them to put on the headset themselves and to perform some of the exercises. This breaks the ice. And in most cases, the therapists then have ideas about which patients would benefit from which therapy application. Therapy schools are interested in new solutions because the whole field becomes more interesting for young people with a smart, digital, modern therapy. Using the system had to be easy, and the virtual exercises had to feel as natural as possible. These were the goals of CUREO's developers. Especially motion sickness must be avoided. This form of nausea occurs when virtual worlds have sketchy programming. Our latest studies have shown that 95% of all users can receive therapy without any adverse effect. Artificial intelligence will expand CUREO in the future. It will also help to come to better diagnoses. We use AI technology in our applications. And for the future, we want to program AI applications by ourselves that are able to correlate patient data and movement data to reach better diagnoses. The big goal of this startup is to make the application usable at home as well. The team successfully laid the foundation for this already. There was another study at the St. Mauritius Therapy Clinic. 300 participants with a damaged central nervous system. Most of them were stroke patients. Most of them were 60 years or older. We had the following results. More than 95% of patients said they would very much like to continue therapy. And more than 93% of therapists recognized an added value regarding increased motivation of the patients.